The Achilles tendon is a unique tendon in our body. It's one of the strongest tendons that we actually have, and also one of the longest. It's unique in the sense that it crosses 3 different joints. It extends just above the knee, passes the ankle joint, and then past your subtalar joint and connects down to the heel bone. Achilles tendon ruptures can be a very devastating injury in the sense that it completely eliminates the ability for you to push off, which is a major portion of our stride or gait when walking. Once surgery is deemed necessary for your Achilles based on both our clinical as well as MRI findings, the surgery itself generally takes about 60 to 90 minutes. We go in and make a posterior incision over the backside of the calf. The process involves essentially weaving those two portions of the tendon back together. And for some patients that have more of a chronic Achilles rupture, which we see in a certain patient class, we may have to do what's called a tendon transfer, where we'll actually go and harvest a tendon to help augment or increase the strength of the Achilles after we've repaired it.